Hey, GLP1 Plus Sides community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things. Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the Plus Sidez, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sidez podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sidez, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sidez podcast. You're not alone. It's not your fault. Hey everyone, before we dive in, I really want to share something personal with you. About, I want to say like 8 to 10 months ago, after losing 100 pounds on GLP-1s and keeping it off for a long time, I started regaining out of nowhere, and I was terrified. But I also started having hot flashes and bouts of crying and snacky cravings and waking up at 3 a.m. unable to go back to sleep. It turns out I was in perimenopause. So I started hormone replacement therapy, which is also called HRT, through a telehealth called Winona that specializes in this. And it changed everything. And now I'm sleeping better and my hot flashes are all but gone, thank God. And I feel like myself again. And it turns out that you can actually start perimenopause as early as 35. And well, I'm 46 and she's here. HRT has really come a long way and there's just no need to suffer anymore. So if you're like this and you're in the same boat, you can check out buywinona.com and you can use the link in our link tree to save some money.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper. With results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster. Confidence higher. Price cheaper. See if you qualify at ro.co/TV.
Hey, Dr. Karla. How's it going?
Good. How are you?
We're doing good. Oh, look. Tell us about your heart.
My whole platform is self-love superpower. So self-kindness to your health goals. So thank you for sharing your stories. Of course, I've taken care of so many patients and children over the years. So thank you for sharing. I'm so sorry for your trauma. Self-love superpower to you.
Thank you.
I love it.
Love it. Awesome.
Warm and fuzzy in the beginning. That's great.
Tell us a little bit about you, because I know everybody follows you. And of course, I'll have all the places to find you. But tell us a little about your career and what you focus on and maybe why you chose to focus on it.
Well, first of all, thank you for your advocacy. Thank you for doing this work. Thank you for getting this out there and creating community, because that's what my work has been about, has been creating community. And so I'm a pediatrician. I have been a pediatrician for a long time, and I've kind of done everything you can do as a pediatrician. And I had a private practice full of patients who I loved, and I started noticing that I was diagnosing and referring to endocrinologists, kids, young kids who had prediabetes or starting to have type 2 diabetes. And when I was in residency, we called it adult onset diabetes. So it's like, wait, what are we, seeing this trend here? And so was following the recommendations of the American Academy of Pediatrics all along. So this was in 2004. I started what was called a Healthy Living Clinic in my practice. So children and families would come, and we had a PhD psychologist and a dietitian and myself and an RN and a fitness specialist. And we would have families come and created this curriculum, and it was really fun. But it was like, well, that's not really enough, because when they leave the clinic doors, I was like, this is a public health issue. I'm not in the community where they don't have access to healthy foods or built community, or PE's been taken away. And so it was like, I started thinking, well, that's fine. I feel fine about it, but we need to do more. And that's when in 2007, the American Academy of Pediatrics published the expert committee recommendations for how a community pediatrician can assess, prevent, and treat childhood obesity. And they published that along with 14 other organizations. And so I just was like, oh, here we go. And it was just like this kind of like bullet point approach. And it, had everything from, of course, BMI focus, because we've been very, we can talk about that and the harms of that.
That's too.
Yeah. We could go on forever about that. But it, talked about BMI and screening and what to do in the clinic, but then also, kind of the policy advocacy. And then at that point, they were recommending what was called a staged approach to treatment. And so it was like, okay, start with your pediatrician, and then maybe come for frequent based on BMI and the comorbidities. So if you had prediabetes or fatty liver disease or PCOS, then you would come in more frequently. Maybe you would involve a dietitian. And then it went on up to like multidisciplinary team, and then up to like tertiary care, like what's found at children's hospitals. And then it was like medications, which at the time there were really any, or low calorie. They were advocating for calorie restriction, unfortunately. And then bariatric surgery. So that was kind of the treatment approach. So I left my practice in 2008 after I launched a nonprofit called Teach a Kid to Fish, creating community solutions for children's health. And I love that. That is the love of my career. And cool. I built this beautiful community collaborative from scratch. I remember when my husband's like, who's going to fund it? I'm like, we are. And I'm leaving my practice. It's just like, I had to do it. And so we focused on healthcare and early childhood and school systems and community. And we had just so many beautiful programs, and it was a nonprofit. So it was a lot of grant writing, a lot of collaboration, and a lot of policy advocacy too. And so over time, I wasn't going to start a clinic, but I kept getting calls from school nurses. Where do we send this kid? And we had a Body Works program in the community that we were running in different like cultural centers, after school programs. And it was awesome, but it's like they really needed a healthcare approach. So it took me 3 years of grant writing, partnership development, coming up with a business plan, and working with children's here in Nebraska to launch in 2015 what was called the Heroes program. So that was a weight management program. And I was the medical director for that. And then I was like, wow. I mean, the thing about pediatric obesity is it's super complex. I mean, you are sharing your stories. And I mean, pediatrics is the most complex medical specialty, I think. And I know that's true. And, and so we don't have a lot of us out there. Like all the training I've gotten has been just completely on my own, And so the next thing after the clinic got going, and I know this is a long story, but it's all important stuff.
Well, I mean, no, it's important. Yeah.
But then so then I started working with children's there was a lot coming out around ACEs, adverse childhood experiences, trauma. And I went to the National American Academy of Pediatrics conference and exhibit in DC. And I heard Dr. Nadine Burke-Harris talk about the effects of adverse childhood experiences on, the body, chronic diseases like obesity and mental health issues. And I'm like, this is what I'm seeing in my practice, the social determinants of health. And so I had been meeting with the population health was becoming really popular, where you look at really like value-based care. That's when the Affordable Care Act was coming out. And so I'm like, this is what we need to focus on. And so I started working with Children's here to acquire my nonprofit and launch a population health center that I led. And that started in March of 2016. They acquired my nonprofit assets and we focused on a systems approach. And so the whole task for me was to build out a whole continuum of care for childhood obesity, on up to prenatal, to treatment, to doing research. We had collaborations with the university and did some amazing work with the American Academy of Pediatrics on a project called Project Echo, where you did telementoring. And the sad thing about that is I was caught in the crosshairs, and I've written about it and did some TikTok posts on it recently and published an article in Kevin MD. I was caught in the crosshairs of what's happening to a lot of physicians in healthcare. And that's moral injury and whistleblower retaliation for speaking up. And so the more I spoke up against who was a toxic CEO, the more those programs got cut. So every time I spoke up, they would cut something. So they cut the program database that we had with the university. We're working with amazing NIH researcher on things like executive functioning, ADHD, food decisions, binge eating disorder. I mean, amazing work we were doing. We were looking at 100 different things, obviously not just BMI, health markers, and they would just cut it. And so it was just severe moral injury. And finally they said, we're replacing you with an untrained nurse practitioner in a clinic that I created, and I was still there. And so over time, that got to be so difficult that my attorneys directed me to resign because it was just so severe. So I was like at a crossroads. I resigned. It was effective immediately in 2019, September 29th. I was truly at a loss because they had acquired $500,000 of everything I created.
Yeah.
And it was like, what do I do now? Like, I don't feel like I've been helpful. The other thing is I went through my own weight loss journey. So I discovered like life and weight coaching. I read the obesity code. I learned about insulin resistance. And I was speaking up saying, we need to be talking about the epidemic of insulin resistance. That's what this is. We can't restrict calories. We're going to cause harm. You know, I was like, BMI isn't helpful. I mean, it's at best net neutral, but it doesn't mobilize a teen, especially to do anything. No. It's boring. No.
Yes.
Yeah. And so I'm like, we've been getting it wrong. We're not doing enough. So anyway, I was like, what am I going to do? I started working with a coach and I decided to go to life coach school. And then I took my obesity medicine boards and I launched IME Community for teens. And then to create this community online and connect digitally, I'm like, I'm removing the middleman here. It's just going to be me, compassionate connection, creating community with compassionate connection, which is what you all are doing. Nice. And then I just launched the drkarlamd.com metabolic telehealth for children and adolescents, which is a really good time with the medications, and I'm licensed in 10 states. So
that's amazing.
That's right.
Yes.
That's great.
Well, I love that because like what I could hear the whole time when you were telling your story is you're a disruptor. So you're a specialist in this area. And I know a lot of people are considering like, is this something I need to do with my child, depending on what age? So we know wegovy is approved for children that are 12 and up that struggle with obesity. And there's different criteria that they would need to meet as opposed to the criteria we would need to meet as an adult. So what is that? And how do you make that choice to even think if that's something that's right for your child?
Okay, thanks for the question. Okay, so first of all, we have to understand that the FDA has approved the medication, so wegovy, semaglutide, for children 12 and adolescents 12 and up as an anti-obesity medication. So the most important thing is we stop calling it weight loss meds, especially when we're dealing with adolescents and children. And it's an anti-obesity medication. Obesity is a chronic disease. It's not like insurance always views it that way, but we know that it is. And so there are laid out criteria Okay. So if it's class 3 obesity is a BMI of 30 or above, I know, we could talk about BMI forever, but this is just how it's laid out. And then the class 2 obesity is 27 to 30 with comorbidities. So if they have prediabetes, type 2 diabetes, PCOS, fatty liver disease, those types of things, then they are eligible and meet the criteria. So first you look at the severity of the obesity. You always want to look at the weight gain, the trajectory, the comorbidities, so the metabolic diseases that are associated with the weight gain, what has been tried in the past. Obviously, we look at things like the family, patient preferences, and we look at things like their eating, phenotype, whether they have a lot of cravings, food cravings, and a lot of insurance plans obviously want you to try something first. Have they been on metformin? The thing that is different for children and adolescents is that there's these recommendations of 26 to 52 hours of comprehensive behavioral support. So like high intensity treatment around, self-monitoring, goal setting, problem solving, behavior support, nutrition, fitness, physical activity, education, all those things need to be in place to prove those. So they'll often ask, have you done this for 3 months? And so that's where I come in to help support that with the clients who I coach with, for sure, and offer with my metabolic telehealth. So yeah, it's a nuanced conversation. But I work with some parents who maybe they take the medication and they've had a lot of success with it, and they would like to open up the conversation with their teen, but they don't know how to approach it. And I usually, because I coach both the parent and the teen, I know kind of their relationship, and sometimes I coach them both together, and I'll be like, you have a really good relational health is what I call it. So just be really transparent about it, because oftentimes they'll be like, they don't even know I'm taking it.
Yeah.
And if you think of it as a health issue, then there's no shame here, and usually the teen is like, maybe they've heard about it, or, they're very open to it. And then that's like one obstacle. And then I'm like, but you can have hope. Things are going to change, obviously. These medications have become more readily available. But right now, there's a shortage of the lower doses of wegovy. So we're not even, that's not going to open up until September. Yeah. And then there's, issues with their own, getting the prescription. So sometimes if they're not a patient of mine, but they're coaching with me, I can, say, okay, go to this doctor here, go to the endocrinologist, ask the doctor for it. Because they're very ashamed of, and having that conversation with the doctor too. So for the parent, it's like not only the conversation with the teen to open it up, but it's also the conversation with how are we going to approach it with the doctor.
Yeah.
You have to get over your own internalized weight bias for that. And then there's the next obstacle of, okay, is this going to get approved? And then, as you all know.
Can you discuss further the emotional development issues that childhood obesity can cause in the moment, and also like say later on down the line in adulthood?
Quick pause here. I've had moments on my GLP-1 journey where insurance changes or rising costs force me to look for a new provider. And honestly, that process can feel very overwhelming. But that's why the Plus Sidez podcast is partnered with GLP Winner to give our subscribers a resource to help them make that decision easier. GLP Winner is a comparison platform that lets you explore telehealth providers in all 50 states, whether you're looking for brand name medications or compounded options. You can see pricing up front, read reviews, and get a clear picture of which provider might align best with your needs. Check it out today at glpwinner.com/plus-sides. That's glpwinner.com/plus-sides. Don't forget the Z. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through the same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need.
"20 seconds a week to lose 20% of your weight in a year with diet and exercise. That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
Well, it's associated with obviously like depression, anxiety. The quality of life measures show that, some of them show that that's worse than a child who's going through cancer treatment. A lot of it is based on bullying, weight bias that is becoming internalized. And the thing that I learned from the researcher I was telling you about, his name's Dr. Tim Nelson, who's a PhD psychologist here and has a child health lab, is he taught me early on with my nonprofit when we were doing work together, not only the power of positive messaging for health behavior change, for motivational change, but also that people really get mixed up when they think that the obesity is what causes the depression and anxiety. But it's really that's not true. It's the bias in the society. It's that internalization. And so when you have, like you experienced, Kat, when you had the first bullies being your parents, where's the safe place for you?
Right.
I wrote an article about that. Parents, stop weight bullying your kid, because there's research that shows weight-based victimization is really a problem in homes too. Yeah. You can have a lighter approach to it. Like when you catch yourself, like you're yourself, oh, there I go again. There's because I bring out my thought rainbow when I'm coaching. So our thoughts are like a rainbow that come and go in your mind.
Right.
You don't have to attach to them. And so a lot of people who grew up struggling with their weight have a lot of past self-beliefs that keep them stuck. And every time you try to take action on a goal for yourself, you go back to that and your mind's like, oh, all the evidence comes up. You can't do it. You're a quitter. And teens have this too. And so your past self-beliefs are only your thoughts about your past self.
Right.
So you have to really do that coaching to say, oh, why am I getting stuck here? Every time you take action, you're going to have doubt. You're going to have, not have confidence. You're going to indulge in overwhelm, but you keep, like you all are doing, you're taking the action. Okay. One thing I want to go back to that I didn't hit on was like the bullying and also social phobias. So social phobias are really strong in kids who struggle with their weight in our society. Thin privilege is real. Weight bias is so bad. Bullying is terrible. And the parents are dealing with, like, they don't want to go to school, obviously. They're not reaching their potential. And so that is, it creates a lot of anxiety. So that's one thing that we work on. And then every client I work with, if I'm coaching them, and then every patient I've ever worked with has experienced bullying of some sort. And then so we work a lot on bullying. And so how to set boundaries, how to be an upstander for yourself, how to create bully bands that you practice. You may never use them, but they may be something like verbal, like a neutral statement. We get really detailed about it. One mom and son I was coaching, her son was really struggling. Like there were a bunch of mean girls calling him hunchback. And so she met with the 504 team, and they came up with a plan to create some physical boundaries around the bullying.
Can you tell us what the 504 is for people that don't know?
Oh, I'm sorry. Yeah, that's a plan. Like if you've heard of like an individual educational plan for maybe kids who have ADHD, health issues, behavioral issues, learning issues, then they have a plan in place for accommodations and support. And so anyway, I mean, you have to get kind of creative, but one of the things we try to do is we don't want the kids to internalize that. We want them to feel like they can be an upstander, that they're not constantly having to be reactive to it. And obviously, if the parents need to step up, they got to step up.
Right.
Yeah.
Okay. Dr. Daniel Rosen, he was on our episode 5. And he told us there is a pediatric, there are pediatric bariatric surgeons, which that kind of surprises. You don't think about that, but of course. But he used an example of the Prader-Willis syndrome as a good use case for surgery. But he also mentioned if there is an FDA-approved medication available over a life-threatening surgery, it's important to have that conversation, no matter how controversial. So what are your thoughts on that and on that topic?
Well, first of all, when I started my pediatric weight management clinic, we have at Children's, they're pediatric surgeons, so they take care of kids. They're really amazing doctors. It's hard to be a pediatric surgeon. It's one of the toughest fellowships in surgery. And so they take care of the very sickest kids. And then they also do, not all of them, some of them do bariatric surgery in adolescents. And so I know the ones I worked with here were kind of drug, kicking and screaming to learn how to do it. But it can be a helpful tool. I mean, it's a tool. It's obviously a very serious one. Usually it's a sleeve gastrectomy that we use in teens. So usually they tolerate it pretty well, but it's obviously a huge life-changing surgery, and they need a lot of supports that sometimes aren't always in place. But the important thing is that you're reducing disease burden with metabolic bariatric surgery in kids. So it's, I had a couple patients who had it and they tended to do pretty well, but I mean, there's a lot of, it's very complex. So for Prader-Willi or there's a whole host of genetic syndromes. Usually those are kids who are going to present with developmental delays, and not all of them, but the things that are the syndromes like Prader-Willi that you think about, they're going to have a constellation of findings. So typically they don't grow well when they're babies, maybe like in Prader-Willi, you have hypotonia, delayed development, and poor growth, maybe the opposite, failure to thrive. And then they'll start in with their hyperphagia. So they'll get severe obesity early on and like this insatiable appetite. And then there's other genetic, monogenetic syndromes or that we can test for. We can do genetic testing now to see if there's other things like POMC deficiency or other like even more rare things that maybe they don't have the developmental issues that go along with it, but they'll have obesity at kind of early onset. And so those are kids who should be tested for that. And the AAP, American Academy of Pediatrics Clinical Practice Guidelines, I don't know if you're familiar with those. Those were just released a few months ago. They got a lot of flack because these are really good pediatricians, but they came out with what, we should be doing, be a really aggressive early on. So they did recommend pushing the bariatric surgery, but the medications and the anti-obesity medications, especially the GLP1s early on. So that's, the hard thing about it is definitely for a kid who has a genetic syndrome, complex obesity, or, severe obesity, especially early on. Yes. get the medications in. It's hard to get a prescription because, I mean, they usually have to go to like a children's hospital or go to a pediatric endocrinologist to get the prescription.
Okay.
Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m. and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you have this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need. Today's episode is brought to you by Ro, a telehealth platform that's changing the game of GLP-1 access. What sets Ro apart? Ro understands the challenges of navigating insurance hurdles and the skyrocketing prices of GLP-1 medications. That's why they specialize in getting insurance approvals for GLP-1s. And if insurance is a barrier, they go a step further by prescribing brand name zepbound vials for prices close to those of compound GLP-1s. With Ro, you're not just getting a prescription, you're getting a partner in your journey that's helping you access affordable treatment and guiding you every step of the way. Whether it's insurance approvals or cost-effective alternatives, Ro is here to make sure that you get the medication you need. Visit ro.co/plussides with a Z today to see how they can help you take control of your weight management journey with affordable, accessible care. That's ro.co/plussides with a Z, making healthcare work for you. Check out the link in our show notes for more details. Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sidez, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sidez podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sidez, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sidez podcast. You're not alone. It's not your fault.